What's up, y'all? Welcome back to From the Ground Up. I have an awesome special guest today. I'm so pumped to introduce her to you guys and have her share a little bit of her story. And honestly, y'all are going to love it because today is going to be all about feet and shoes and how it's truly like the thing that we are missing so often in people in general, but especially our pelvic health clients. So let me introduce her. This is Delaney Smith. She is the founder of Minnemals Barefoot shoes, and she is a specialist in muscle activation techniques and gait analysis with over 7 years of experience helping people move better from the ground up, which we love over here on From the Ground Up. Through her work, she's seen firsthand how much dysfunction and weakness truly starts in the feet and how often it's overlooked. And that insight is what led her to create Minnemals with a mission to change the norm around overly cushioned, overly supportive footwear, and instead help people rebuild strength, stability, and sensory awareness literally from the ground up, y'all. She is passionate about educating people on why your feet are not something to baby, but they're something to train, to trust, and to truly use. So welcome, Delaney. I am so excited to talk to you.
I know. We've been looking to connect for so long. I'm so excited to finally get into it.
I know. I think I came across one of your reels on Instagram like months ago, and I was like, oh, I gotta DM this girl immediately because you were talking about something with footwear and how just all the things. And I was like, yes.
Yeah.
So that's how this relationship was born. And I had to get you on my podcast. So I'm so excited. So to dive in, as someone who has also built a brand and a clinic and frankly a career around kind of this idea of treating the human body really from the ground up, I would love for you to kind of take us through maybe like a core moment when you realized that the foot was critical and decided to go all in on it, with your clients and frankly by creating a whole footwear brand. So I would love to just kind of hear how that happened.
Yeah, because it definitely didn't start that way. But one of the, I don't know that it was one moment, but the exercise toe yoga where we're just asking to, dissociate. Can you just lift your big toe or just lift your little four toes? And the amount of times that I would ask a client to do that after realizing, okay, there's, clearly something going on with the foot here. Let's, sit you in a chair and let's just see where we're starting. And the amount of people, regardless of the age or athleticism level or health level, anything, could not make anything happen. You're like, this is attached to your body. No different than your hand is. And how concerned would we be if you couldn't lift your thumb up? And so that was one of those, there's something here. When it's such a widespread thing, you're like, there's some common denominator here. That was, but that was multiple people. So it kind of just kept reinforcing that each time.
What was making you with those people, assess and or prescribe toe yoga in the first place? Like what, if you hadn't gone down the rabbit hole yet, why were you starting to be like, okay, let's do some toe yoga?
Well, my whole story has been super organic and just woven together because it started with taking more courses within the foot and learning more about it and then getting into gait analysis. And I feel like anytime you learn more, you have so much more appreciation for it, and then you're assessing it more and looking at it more. So I would say just the more confident I got with treating it, the more I started to look there. Yeah. And then, it's just a quick assessment tool of like, okay, well, let's just see where you're at.
No, it really is. And truthfully, I give probably 90% of my patients toe yoga. Just as one of those things where I'm like, as we've started to assess kind of from the ground up and start to find a lot of these things at the foot, that's a good one because I found that it gets buy-in pretty quickly because my patients are like, wait, I can't do it. And I'm like, no, literally, I know. And let me tell you why that's immediately needs to be fixed, So even in my pelvic floor patients, I'm like, you need to be able to do this. And from a pelvic floor perspective, which I know you're not a pelvic floor specialist, but you know the human body is all interconnected and everything. But from a pelvic floor perspective, that dissociation of the toes and the foot in general is vital, not only like biomechanically speaking, but also brain. In our brain, we have that fancy thing called the homunculus that I remember learning about at PT school. That's essentially just talking about our brain kind of maps areas of our body. And the foot is right next to like the genitals and the pelvic floor in our brain. And so that's always a cool thing that I like to share with my patients is I'm like, yes, there's all these like kinetic chain biomechanical things of why your foot needs to get moving, but also, from like a brain, a sensory, a proprioception standpoint, we've got to wake that section of your brain up because you're peeing your pants and you also can't move your foot. So there's a connection.
The dissociation is insane. And it's not that they're not working. It's just they haven't been brought together in so long. The brain hasn't gotten anything for so long that it's wild to look at it. And, people will sit there for so long and be like, I'm trying, I swear. I'm like, I know, it's going to take time. It's just, I know. Yeah, like you said, it's a good buy-in because like this is attached to your body. How are you not moving it?
Yeah. And then they get so proud when they come back and they're like, look at my foot, I can do it. And I'm like, and how's your leaking? And they're like, it's better, and it's just awesome. A full circle. So I love it. So walk us through your training because you're not a physical therapist, which is great. I love having, just various movement professionals, but tell us a little bit about your background.
Muscle activation techniques is what I got into right out of undergrad. So it's its own specialty. We work all with the neuromuscular system. I do pretty much a ton of muscle testing all day long for each muscle, trying to test how well your brain and muscle are communicating in that end range position and the strength and stability there. Once I took a higher level course on the foot, that was what prompted me to reach out to, a couple people being like, where do I find more about gait or foot or, I just felt like there was more there than what I had learned and I wanted a different lens from it. And so that's how I sought out gait analysis and then took, if Gait Happens, I took their first in-person course and I just happened to be there because I just found them. I was like, oh, you guys are just getting this going. This is amazing. And then took their level 2, and just the repetitions then of watching more people walk, assessing more people on the table and feeling what they have on the table then compared to what do they present when they are walking or in movement, just really brought everything whole picture of, okay, there's huge.
Yeah. So is that like a marriage of the muscle activation technique and then all the gait courses and studying you've done, you've kind of brought them together in a way to make it like this beautiful functional connection, right?
Yeah, not everyone does a gait analysis with me, but especially if it's, if they come in for a shoulder, I probably am not starting there. But it's just another lens for me to look through to really assess dynamically how does that present. And then, if someone's coming in and saying, well, I get pain when I walk more than 0.2 of a mile, okay, there's probably some things there. So yeah, just another lens for me to look through. Different treatment, MAT is all on the table. Like I said, muscle testing, treating. And then gait stuff is more about, a strength or mobility issue typically. And sometimes I do all the above.
Yeah. Based on kind of like the human gait cycle, I'm guessing.
Yes.
As we're like looking at how they move through space, basically.
Yeah. So going back to the big toe, if there's no dissociation between the big toe and little toes, or, you can't get them to move independently, you're probably also not going to have great strength there. And so when you don't have great strength in the big toe, your body's not going to want to load and then push off of that because that's what it's supposed to do. But if it's not strong there, it compensates very easily. So you can pick that stuff up very easily by just watching someone walk.
Yeah. I love that. So as we kind of paint a picture of what you do, before I get into like foot nitty gritty, who is like your ideal client? Who are you working with? What are you helping them overcome in general?
I have a lot of chronic pain and seemingly out of nowhere. So I would say if I had to dwindle that down even more, I would say women with hip issues, or they have hip pain, I should say. And more specifically, that have had a kid at some point in their life.
Yes.
Is like
interesting.
I think you might be able to shed some light on that too. I would say that's my most popular, but I have a lot of chronic pain from, head to toe. I also treat, the neck as well. But so I see a lot of different things, but I would say not that many people specialize in the foot. And so I think I've gotten more and more off of that as well. So I would say hips and feet are my two biggest areas.
I love that because you really can't separate them. You really cannot separate them.
Yes.
It's like if you have a hip problem, you have a foot problem. If you have a foot problem, you have a hip problem.
Okay.
Whether you have symptoms or not, we're going to see biomechanical changes in the chain. So that's so cool. That's so cool. So I want to start kind of getting into the foot nitty-gritty a little bit. So many of us, just movement professionals, clinicians, we have been taught that we need to be putting our patients and clients in a, quote unquote, supportive shoe, right? Like I learned that in PT school, and that's the general message. Okay. And so I would love if you could speak to kind of why that's actually the literal opposite of what people need and why.
Most of those people that will come to me that have already been in an orthotic or always in the supportive shoes, and this was kind of what led me into Minnemals as well, is they would sit down and they'd say, but I've always worn good shoes. And that being, the supportive and cushioned that they've been always told to, which tells me they've probably been to a podiatrist at some point or a PT that was more traditional thinking. And it really only makes the issue worse, like the underlying issue. Because if someone sits down, like if I could pinpoint one demographic that has pretty much no foot strength at all, is someone that has had plantar fasciitis for years and has therefore worn orthotics or a certain type of shoe for years in response to that plantar fasciitis. And those people are only further kind of reinforcing that issue of the underlying strength issue when they're continuing to wear the cushion and supportive shoe. So it should be used as a tool, in my opinion. It should be used as a tool. Short term, I'm not someone that prescribes them out, but there's never the conversation of what does months worth of and years worth, because let's be honest, we should really actually talk decades of how long people wear them. No one talks about what the secondary weakening and therefore dissociation, because it restricts so much movement within your feet. And depending, even if it's not a rigid orthotic, like some of those rigid soles, like there's very little movement happening and therefore very little feedback getting sent to your brain, so on and so forth. So to sum it up, a lot of times the underlying issue is a strength issue, and those orthotics and cushion shoes are only reinforcing that weakness.
Yeah. And a big thing that I teach my patients is to strengthen any part of our body, we have to have the range of motion and control through that range of motion to load into the range, and then the strength to explode, for lack of a better word, like out of it. And so what I'll tell them is I'm like, you've been wearing these shoes for your whole life, essentially. Your toes are like, they look like a knife blade. Like you can't do toe yoga, all of these things. And then of course I tie that a lot, like, I tie that back to their pelvic floor symptoms. Based on the person, it always looks slightly different, but I'll explain that like we do have to strengthen your foot, and you've been in these foot casts, overly supportive shoes for so long that your feet have not been going into that full range of motion, which has contributed to this weakening. And I found that kind of picture of any joint, any body part needs full range of motion, right? And like most people can be like, oh, well, that makes sense. And I'm like, yeah. So why are we restricting your foot to where it's not getting its full range of motion? And it comes back to, well, I was told to wear these and my doctor said this and I saw this online or whatever. But I just cannot stress enough the foot more than anything in the body, but especially like every joint needs full range of motion and control and then propulsion strength. But we cannot forget our feet, because that's literally what is supporting everything on top of it and moving us through space. And I'm just like, I know, because this is what you do for your whole life. But I'm like getting excited because nothing lights me up more than the foot. So, oh my gosh. But what about these people who tell us, and I hear this because I'm a proponent of minimalist shoes, barefoot shoes, all the things. But what about these people who say we didn't evolve to walk barefoot on concrete? Because I've heard this, clap back of like, well, yeah, cavemen were running around on the earth barefoot. So what would you say to those people who are kind of saying we're not made to be barefoot on concrete?
Yeah, it's like the biggest counter argument, and I don't know why. Anyway, I chalk it up to the same as people that will say, I have to wear a foam slide at home. Like, I can't walk on hardwood floors. Your body is used to that. So same thing with like nurses and teachers or people that are on their feet all day. They're super apprehensive about it too, because they're like, I'm on hard floors. I'm on my feet all day. And you don't get there overnight, but your body's just used to what you've been, you need a foam slide because it's only felt a foam slide for so long. So I think same thing about, there's some truth to like, if you're going to go to Disney and you don't do those types of steps all day long, by all means, use a bigger shoe, great. Yeah. I have no issue with that. But this thought that you need to be on soft pillows all day long, like, okay, how did we evolve to that? Like our feet just needed a maximalist shoe to be able to work properly someday. Like that doesn't make sense either. So I think it's a matter of your body is used to what you're providing it, the environment you're putting it in. So just needs time to adapt. It's very strong. And it's like, very resilient.
I was about to say, it's like anything else. Like I wouldn't just not help someone's other body part because this is the world we live in and we're not, we're not made to sit in chairs all day and you have a desk job and I'm not going to be able to help your back pain because you sit at the desk all day. To me, I'm like, that's the same argument. Yeah. Of course we're not made to sit all day, but some people do. And that's the reality. And like, not everyone walks around on concrete all day, but some people do. And our human bodies are so resilient if we train them to have that capacity and graded exposure. And it's like we can ultimately train our human bodies to do literally anything. Yeah. It just takes time and it takes a provider who knows how to get you there and knows the importance of doing so. Right. Yeah. So I just wanted to get your thoughts on that.
Yeah. I don't know if you have a lot of nurses, but like I said, like nurses and teachers are a common one that there's kind of that fear because again, I've been on my feet a lot, therefore I need this type of shoe. But it's interesting the nurses that I have come into contact with or teachers that have worn my shoes that, they started smart. They just did little by little, but now once they're used to it, they're like, I can't wear anything else. And like that demographic is so pushed on the big shoes, the big,
it's so true. It's like big pharma, but it's big shoe. No, I'm just kidding. It
is.
Not to go into
big shoe. There's big shoe.
Not to go into that debate, but it's just, we're getting pushed an agenda of the shoes, you guys.
Yeah.
But yeah, it's just wild to me. But nurses and teachers, yes, we see them all the time because I don't know if you've heard of this. Have you heard of like nurse bladder or teacher bladder at all? Have you ever heard of that?
I just remember like teacher pee where they would have to hold it for so long and then they come one time.
Yes. And it's teachers and nurses who hold their pee all day because they are busy and they don't get breaks and their lunch is 15 minutes long and it's their only second away from children. And it's like they just hold it, and at best they're going once in the middle of their shift, which is, holding 6 hours at a time. And at worst, so many of them hold it for the entire shift or they wait right up until the very end. And by then it's been 8 to 10 hours. And it's like, y'all, the only time our bladders are meant to do that is when we're asleep, not when we're up moving around. And so, yes, we see in pelvic health teachers and nurses all the time because, that's a whole other rabbit trail is like bladder signals and the, nerves of the bladder and it alters the contractility and the signals and all of that stuff. And there's a biomechanical component to it as well, where it's like, if we're in these restrictive shoes and you're on your feet all day and your feet are not getting their range of motion and they're not absorbing those forces and transferring those loads and all the things, we see it up at the hip and the pelvis, thus the pelvic floor. And then we get, I'm like, if your feet are not absorbing things, your pelvic floor has to pick up the slack. It's kind of our next absorber, if you will, as well as like the hip rotator muscles. And so it's like, my nurses and my teachers they all have tight posterior pelvic floors and that bladder is being shoved forward and further irritated and distended and all these things. So yes, we see nurses and teachers all the time in pelvic health all the time.
Question for you I just thought of as you were talking about that pelvic floor being the next shock absorber with the hip rotators. So I was just talking to someone about how and I'll use this a lot with people about how if you go run even, like 20 yards barefoot or even just go walk barefoot, how you will feel that your body naturally softens your stride because your brain can feel the force that you're pressing down with. And so therefore, like, you don't need to have such a heavy heel strike. It'll just be a much softer, lighter gait, which is actually a cue that I use all the time for people that are so, not absorbing shock well. I'm like, let's just walk lighter. Let's just low hanging fruit. Just try to walk softer. Anyway, you can't feel, your brain doesn't feel that when you have so much foam underneath. And so you're still landing just as hard. You just can't feel the force through your heel. So I was wondering, tying your pelvic floor into that, like those forces then going through your pelvic floor.
Yeah. So there's studies, which I'm sure you are aware of, that show the more cushioned a shoe is, the more force we will see up at the hip and the pelvis. And, by extension of that, the less cushioned a shoe is, the more the ankle and the foot, and then up into the shin and the knee and everything will have those forces, which, by the way, they're meant to. So it's not a bad thing. But yeah, what we see all the time is, my moms and my women come in their Hokas and they're on clouds and all the things, and their pelvic floors are clenching for dear life. And they're just like tight and restricted, especially posterior, because, the biomechanical changes when we don't achieve that midfoot pronation and then into ankle dorsiflexion, then we lose out on internal rotation throughout the kinetic chain. And we actually need internal rotation, both of the femur inside the pelvis, but also the pelvis on top of a femur. We need that to get expansion of the posterior pelvic floor muscles, which kind of balances out the pelvic floor and allows it to transfer loads and absorb forces and shock a lot better. And so quite literally, the feet, or the shoes, I should say, that we are wearing on our feet change the biomechanics. And when you wear those for, like you said, years, decades, even months, we'll see changes in months of wearing a certain shoe. You change the biomechanics up at the pelvis, thus the pelvic floor. And we see a lot of that posterior kind of tension, anterior kind of overly lengthened. And then we run into the typical kind of length tension relationship of muscles, where if we know if a muscle's too short, it doesn't work. If it's too long, it doesn't work. And so we have this imbalance in the front and the back half of the pelvic floor. So that's a long answer to your question, but that's kind of the biomechanics of the changes, and it just shoves everything, all the pressure, all the organs forward. And now we wonder why our moms are peeing their pants and they feel like their bladder's falling out, right? So, and I have SI pain. I'm like, your SI joint is compressed. It can't move. That's why it hurts.
Yeah. Yeah. So much of that. So interesting.
Yeah. No. Yeah. All the things. So talk to me now about cushion. We've started to touch on it. I asked about the supportive kind of foot cast, if you will. Talk to me about this cushion, this proprioception, maybe how you see that showing up in some of your clients, because, I think patients in general, they can kind of get on board with like, oh yeah, I understand I don't need an overly supportive shoe. I know my foot needs to move, but it takes them sometimes, for me, in my experience, a little longer to come around to the cushioning because it feels good. It feels good to walk around on pillows and clouds, right? So talk to me a little bit about the changes that we can see from a cushion perspective.
Yeah. And especially with those people, reiterating, it doesn't have to be black or white. You don't have to now, never ever, like those Disney days or, the day, anyway, doesn't have to be black or white. Sometimes the barefoot shoe train will be super black or white now, especially someone getting into this. Because I have those hesitations with my clientele as well. So what cushion does is it's blocking those nerve endings. So we've got hundreds of thousands of nerve endings on the bottom of our feet, just like our hands, that send all this information to your brain about what it's feeling, how to balance, how to move, so on and so forth. The more you put between the ground and the foot, no different than if you wore a really thick glove, the less your brain's going to feel. And so that can plays into that dissociation I was talking about. But especially when someone has balance issues or is coming because, we're working on their foot or we're working on their hip, like teaching someone to rotate at the hip, they also have to learn how to plant their foot. And if you're wearing a thick shoe, you can't feel that. So from I guess I'd call it rehab or relearning some of these things,
Yeah.
you have to be barefoot or in a barefoot shoe, I guess, but even better if you can be barefoot. But
Yeah.
your brain doesn't know how to move you and dictate muscle engagement, your patterning, how much to do if you can't feel what's happening. And so, again, the more cushion you have, the less feedback your brain's getting from that foot. Therefore, the less informed, we'll call it, it is to make those, to alter your movement.
Yeah. That makes me think, you know how you learn something new or you become aware of something and then you start seeing it everywhere? That has a name. Is it like it's like our reticular activating system?
I know what you're talking about. Yeah.
Yes, but you start seeing it everywhere. Okay. So I've always been a PT who is aware of the nervous system. I understand the nervous system's role in human movement, in like literally everything, in gut health, in pelvic health, in movement, in emotion, like all of the things. Like from a brain perspective, like I understand that. I will say, to call my own self out, like I feel like it's really been the past 6 to 12 months of my career where I am like, oh, like the nervous system it trumps everything. Cause like I love me a biomechanics. Okay. Like please, like let me look at your kinetic chain. Let me look at your internal rotation. Like let me just, I just love it. I love it. And it's not that I feel like I used to disregard the nervous system's role in biomechanics and movement, but like I think I had it like flipped, where it's like, yeah, the nervous system's important, but as long as you get the range of motion and you get them moving. But I think what I've learned is you only get the range of motion and you only get them moving and you only clean up their biomechanics because the nervous system said so.
Yeah.
And so what you were describing made me think about that because part of the nervous system is this proprioception. It's the nerves, obviously. And it's this idea of if the foot, I'm gonna oversimplify it a little bit, but maybe it's not oversimplified. If the foot doesn't feel safe, right, to like balance you and to absorb those little like micro force movements and transfers and things, like that's when we see the gripping foot or we see the arch that becomes less mobile or whatever it is. Like there's a lot of ways that we'll see changes.
Totally.
But it just got me thinking of like we have to, even in our people, even in their feet, like we have to create for the nervous system a sense of safety in that movement. We have to train their brain and their body to feel okay going into pronation, to feel okay going into dorsiflexion. And, so anyway, it just made me think of that as you were saying, like, they can't feel the ground. And that's like their brain can't. It's like, well, I can't feel the ground, so I'm going to clench everywhere else. I'm going to clench at the pelvic floor. I'm going to clench here. I'm going to just lock everything down to stay still and don't like fall over or whatever. So I thought that was interesting.
Totally. With muscle activation techniques, it's all neuromuscular. And so I'm constantly having the conversation of your body's only going to give you the range of motion that is stable. If that brain and muscle aren't communicating as well as they should be neuromuscularly, it views that as like, well, the brain's not getting feedback. And if it's not getting feedback, it doesn't know what's going on. It always wants to know what's going on. And if that underlying instability is there, why would it give you more range of motion? It's going to tighten that up because we're safe here, not safe here. Protected here, not protected there. And it's totally, especially when the nervous system's been overstressed. Like that's when you see those pains start to come about, which has been, in the works for many, many years, of course. But it's like, well, yeah, why would it give you more motion? Yeah,
exactly. Oh my gosh. I love it. I love it. So tell me, what has been your experience kind of, because you're a business owner, like in marketing this idea that tends to go like against the grain, if you will, and push us kind of to question these ideas that we've been taught for so long. I have a lot of business owners listening to this show and they all want to do things differently and better, or else they wouldn't be listening to this show. And so I would just love to hear, like, what have you bumped up against and have you received pushback and, do you have any juicy stories? I don't know.
Yes, I have to think about the juicy stories. I'm a little bit spoiled with the clients that find me in that I am very alternative. And so I'm not usually their first stop. They have done the gamut of the traditional route and it's not working for them. So then they find me. So that's, I would say, the norm in which then they're very open-minded to it. But especially when we're talking about the footwear thing, I get a lot of pushback. And it takes me a long time to really, I should say, if it's already an established relationship, you typically already have that trust to where they're going to believe what you're saying. But especially with a new client, they're coming in, let's say they have hip pain, and I'm talking about the foot, I'm talking about the shoes and everything we're talking about. I think it's in your delivery. And so what I mentioned before, like, it doesn't have to be black or white. I think that's huge because some clients will, like I do have some people that will come in and they bring their whole shoe closet. They have like 2 big duffel bags. They come in with them. And I'm like, all right, let's lay it all out there. And it's
like, all right, let's go.
When they're like, they want to go one by one of, well, what's wrong with this? Is this good or bad? Is this good or bad? And I think that would be a point what I would say is not painting it to be good or bad. Like, people will always ask me, are these shoes good? It's not about being good or bad. It's about understanding what wearing those, what effects it has on your body. And so I think it just can be overwhelming when I've always been taught this, and now you're telling me to do this, but they don't have to get there overnight. It's like little easy, low-hanging fruit. Okay, like you said, like toe yoga, let's start there. And then let's build off of that. So I would say delivery is the biggest, and like how you approach it with them. Because they are coming to you for your expertise, and, you know,
totally,
that trust is only going to get stronger, but I don't think it needs to be plopped on the desk day one. Here's everything. And especially when they're like, do I have to go buy all new shoes? It's like, well, no, not yet. You'll want to.
Not yet. No. No, that's so true. And it's just like any kind of client-provider relationship. It's all about like the trust and building that relationship and getting it to a point where you know them and kind of what level they're at with how much they're honestly ready to hear, you know, and there's some people that I will just day one be like, let me tell you about the foot and the homunculus and everything it's doing. And then there's other people that I'm like, let's breathe, you know, and it's like, you just, but in my head, I'm like, and I'm going to get to your foot, you know, but it's, you have to kind of read the room and you have to kind of know who you're talking to, how open they are. It's like their stage of readiness of like hearing this stuff. Cause you also don't want to scare people away if they come in and you're like, you have prolapse because your feet are bricks. And it's like, they're going to be like, what? What? And they're just never going to come back because they were not ready. They thought they had prolapse because they need to do more Kegels, which is, that's a whole other like journey that I would go down with them. Their OB said to do Kegels. Their chiropractor said to do Kegels. They saw online this PT from Australia leading them in Kegel exercises every day on Instagram. And it's just like, then they're going to come into me and I'm going to be like, it's actually your feet. And they're just, it's just going to go over their head. So I agree with you. I think it is like, read the room, know the client in front of you, know what they're ready to hear, know how to build the trust. And you can have all the thoughts in your own head. And it's up to us to kind of be their leader and guide them along the way. All this stuff.
I think one client just came to mind who probably honestly hasn't gone barefoot for decades at this point. She's in her 60s or 70s, I want to say. I will tell her, like, my goal in the end is to get her to be comfortable walking around barefoot. And that's very scary to her. But we're starting all the way here. So sometimes I will lay out, like, here's where I want to go with you. We're starting step 1 right here. And like, we're not making any changes to all these things. We're just going to start here, you know, making them feel comfortable.
Oh my gosh. That is a concept I coach my team on, my therapist on, I coach other therapists on, and you just said it so beautifully. It's like, that's how we lead our patients and our clients is it's up to us to kind of hold the vision for them when they can't even see it. We know what they're capable of and what we can get them to. And so it is up to us to kind of hold that vision, paint that picture, but still show them, hey, like, here's this map. Here's where, like, I'm going to help you get to. Here's where we are. And this is what it's going to look like right now. And this is, you know, how we're going to kind of, you know, transition along the road. And I think that ever since in my company, we got out of my head because it lived in my head. And we finally, I worked with like a marketing lady to help me do this, got it out of my head, and we wrote down the Genesis method. And it's the patient journey all the way, starting from like finding root causes and low-hanging fruits to, you know, remapping how the brain uses the body and the pelvic floor and the foot and all the things, and to refining our process. And, you know, we go through that whole rigmarole, and then it's like, then we build resilience. And then guess what? You've not only met your goal, you've probably crushed it, and you're on to the next ones. And so I totally agree with you. It's like, that's how we lead patients, and that's how we partner with them while still being like their guide and taking them from point A to point Z, you know, along the way. So I love that. I love that. Yeah, that's really good.
I would also remind them what they've been doing isn't working. I don't know how many of your clients have already tried pelvic floor PT somewhere or done the Kegels.
All of them.
And they're looking, and they're clearly it's not working for them. So they're finding you, and they're coming to you because they want something different. And so I would remind, if the orthotics were going to work, they probably would have worked already, but maybe we need a 12th year of them, and then they'll work, you know. So reminding,
a 12th year, a different shoe. All
yeah. There's that Goldilocks shoe they just haven't found yet. That's
right. I'm like, we just got to fix your foot. That's what the missing link is. No, it's so true. And it is most of our patients. I mean, some people do make it to Genesis like for their first go, you know, thankfully. But I will say, kind of like our messaging and our specialty, not to go too much on a tangent, but is like, we can help you even when no one else could. And so we are, you know, a premium clinic. We're cash pay. We charge what we're worth. We charge for the results we're going to get you. And so a lot of times patients will go try the insurance-based provider or, you know, this program online, and they'll get 50%, 80% better, and then kind of stall or get not at all better. Right. And so we do get a ton of those patients that's like, I've tried all the things. I tried to avoid paying this and coming to Genesis and doing the things, but here I am. And I'm just like, it breaks my heart, because I'm like, I wish you would have come 2 years ago, you know, but no, I love it. I agree. And I'm loving these insights. I would love for you to tell us now, before we kind of wrap up, about Minnemals, about your shoes, which, by the way, I totally have a pair. They are quickly, I'm not even just saying this because you're on here, but they're quickly becoming my favorite pair of shoes. They're so cute. They're comfy. I got the light pink ones, which your girl loves the pink. It's one of our like it's in our brand colors, but like not in our brand colors. I forget what that's called. It's like a secret brand color.
Like your accent.
There you go. It's an accent color. And so it matches literally all of my work outfits. I wore it in our photo day for our Genesis photos this year. And I have to tell you, after photo day, which my mom works on my team, so she saw them, she showed up at my house like the next week, dropping her dogs off because I was babysitting them, wearing the pink shoes. And I was like,
my gosh.
What? So she like had gone online and ordered them. That's awesome. She loves them. She loves them. So I need you to tell us about your shoes, because I think everyone literally needs them. Okay.
Well, you kind of just thankfully took care of my why behind it. So all of the conversation we just had is the why.
Sure.
So a shoe, you know, it's a low-hanging fruit where you're going to strengthen your feet more. We're going to get more activation, more sensation, more nerve stimulation by wearing a barefoot shoe like Minnemals. I wanted a couple things to be different. I wanted it to be a little bit less extreme. So there's just a little bit more shoe to it than some of the barefoot shoes out there.
Yeah.
Pros and cons to both. I just wanted it to be a little bit easier for someone that's never worn a barefoot shoe before. But it was really to have a bigger platform to talk about this, and then have a less intimidating option for people, both in style and then, like I said, to be just a little bit less extreme of a super thin.
So you wanted it to be a barefoot shoe, a minimal shoe, but not quite as barefoot as some of the other ones, which I love, because I do work out in the other ones and love them. I love to feel the ground whenever I deadlift. I told you, I was like, these shoes are too pretty for me to work out in, but now I'm low key like, do I just order the black ones? Because I can't work out in my pink ones. They're going to get dark spots for my gym floor, but I love that. I just love it. So do you just like tell your all of your, well, I guess your clients, do you tell them to get your shoe? Like, how does that work? I'm curious because you obviously treat clients for symptoms, and then you have this other business that is a potential like tool to use. So how does that work?
I'm a terrible marketer for my shoes with my clients because I don't want it to be like, I'm telling you this, and here's the shoes that you can buy for
and
them.
Here's
you
the
know,
shoes.
so like I've had some clients be like, "Hey, I really want to buy some shoes. My trainer sent me your link," and I'm like, "Your trainer told you before I told you about it." Dang it, that's a fail on my part. But yeah, so I definitely have a good amount of them that do wear it. I also have a good amount of clients that I wouldn't recommend them for, being that they have a structural change to their foot. So I think that's an important conversation too. With the whole black or white, like I think that the majority of people and the mainstream people should be wearing a shoe like Minnemals, and then the people that have had an ankle fusion, have hallux rigidus or severe arthritis, like okay, those are going to be the people I'm more conservative with. But as a general rule, if you just keep your feet moving and activated and strong, it can prevent so many things down the road from a young age, right? Yeah. We can go back to the conversation of how young this starts.
Yeah, I've had my kiddos in barefoot minimal shoes since I knew about it. So since probably, because right now they're 9 and 7, probably for sure my daughter, my younger one, has always been. She's never had like your typical toddler shoe. I feel like my son probably was 3 once I like learned, and I was like, change everything about his footwear. And, so they wear them, and it's like, and they're great. Their feet are so like wide and just strong looking. And I'm like, y'all are going to have such a competitive advantage of everything in life. You're going to have less pain. You're going to be better athletes. My daughter, I'm like, you're not going to have pelvic floor dysfunction, like all the things. So,
and you're welcome.
And you're welcome. Yeah. What a great mom and PT I am. No, so great. So great. So if you could leave us kind of with one core message, something that if we heard nothing else that you said at all today, what would it be? What do you want us walking away with?
I want you to not be scared to load your foot and strengthen your foot and work those foot muscles. No different than you're supposed to with your hip muscles or your bicep or any other part of your body. To appreciate how important the foundation of your body is and how that affects literally everything else of the body.
It literally does. Everything is infected and impacted from the ground up. Thank you so much for being here. This exceeded all of my hopes and dreams, and I just love a moment to nerd out about the foot.
I know.
So thank you. So where can people find you? I know you have Instagram. What's your website for your shoes? All the things, and we'll put this in the show notes, but tell us also.
So the shoe brand Minnemals Barefoot Shoes is Minnemals, which is found on socials, and the website minnemals.com. If you happen to be a local Minnesota native, my practice is in Edina, and it's Minnesota Muscle Activation.
Amazing. And that's your social media handle too, you said, right? Like it's not like Delaney something. It's literally, it's the Minnemals, right?
Correct. Yep. Minnemals.
Okay.
Yep.
Amazing.
Yep.
Amazing. Well, thank you. This was awesome. I have no doubt people got so much out of this, honestly. So I'm thankful. I'm thankful that you came and spent your time. And you guys share this episode. I know it was helpful, so share it. Normally I'm like, if this was helpful, share it. But like literally this was so helpful. So share this, tag us in your stories, share it with a fellow clinician, coach, provider, share it with your patients. Like, hello, get your patients' feet moving better, stronger, so their pelvic floors work better, please, for the love. And that's how we get this word out, y'all. That is literally how we change the game of pelvic health, is we share stuff like this, because how else are other people going to learn it if we're not sharing it? And that's how we're better together, right? So have a great day. Share this episode. We'll love you forever. And let's change the game, y'all.